The purpose of this blog is just to talk about some of the reasons why an injection might not give the pain relief that the patient was looking for. So we're going to just explore some of the different reasons why this might occur. So oftentimes we will get a call from the patient maybe just a few days after the injection saying it doesn't seem to have worked. So just to say that steroid, because of the way steroid works, can take at least, I would say, 3 to 5 days. In most cases, it can be up to 2 weeks for the steroid to exert its full effect. So I always say to patients, look, judge it after a week and even 2 weeks in certain conditions, particularly if you've got, for example, like a nerve type problem. So Morton's neuroma, carpal tunnel, I see these ones taking sometimes the full 2 weeks for the steroid to take effect. The severity of the condition is obviously a big factor. So particularly, for example, if we're injecting, say, for example, a shoulder and the rotator cuff is completely ruptured, or we've got an arthritic joint and the level of the arthritis is quite severe, we've got to be realistic about what steroid can achieve when there is a very severe degenerative change or structural abnormality. And the clinician will talk to you about this at the time of the injection. It's not always as clear cut as to say the more severe, the less benefit is going to give, but it certainly can be a reason why you're going to experience less pain relief. The next reason is previous steroid injections. Now, this is a little bit of an ambiguous topic, and we don't really know to what extent here we're talking about the natural sort of progressive degenerative change. Obviously, a lot of patients, if we're doing repeated steroid injections, it's because they do have an age-related degenerative condition, such as an arthritic knee. So we don't know how much of it might be the progression of the condition and how much of it might be that people are building a tolerance to the steroid. But we would certainly say that there does tend to be a diminishing return after people have had a number of steroid injections. So the next reason why an injection might not work is an inaccurate injection. Now, obviously, we're doing our injections under ultrasound guidance, so that should generally significantly reduce the risks that the injection is not put in the right place. It can happen, but it can significantly reduce the chances of this happening. People will say sometimes that they've had previous injections with, for example, their GP or with a consultant, and it wasn't performed under ultrasound guidance. And certainly when they're not performed under ultrasound guidance, then them not being delivered accurately can be the reason. So another reason why the injection might not have worked is that the diagnosis might have been inaccurate. So when you're having the injection, again, you will have a clinical assessment usually before having the injection. But there are times when a diagnosis may be ambiguous. It may not be completely clear. So in this way, sometimes a steroid injection can actually aid with the diagnosis, because if it doesn't work on the structure that we thought was causing the problem, although you don't get the pain relief, it can help to give some clarity to the diagnosis. Another reason why you might not get relief is if there are multiple reasons why you're experiencing a pain in a particular area. Now, to give an example of this would be sometimes people might come in presenting with pain in the palm of their hands. And so the clinical diagnosis might be one of carpal tunnel syndrome. But carpal tunnel syndrome quite often coexists with a problem with the neck, like sometimes referred to as double crush syndrome. So if you've got symptoms referring into your hands, both locally from compression of the median nerve and from nerve irritation referring down from the neck, in this case, the steroid injection may only be able to deal with the local symptoms. If the majority of the symptoms are coming from the neck, unfortunately, we're not going to get much relief. When we're providing a steroid injection, it's usually done as a part of a program of treatment. So we're given a steroid injection and the person will be advised to go off and have some physiotherapy, have some rehabilitation. So one of the reasons why steroid injections may not give as much benefit or as longer lasting benefit as we hoped is that the person may not do the exercises, or they may not follow it up with the rehabilitation and be too reliant on the steroid injection by itself. to give relief. And we pick up on this, a number of times. Patients will call in. I say it didn't seem to work very well, and then it transpires that unfortunately they didn't do the exercises or the rehabilitation that was recommended. So always see the steroid injection. Vast majority of cases, it's part of a package of treatment and not a standalone treatment. So steroid injections work by steroid is a potent anti-inflammatory, and so one of the key indicators of how much the steroid injection is going to give relief is really how much of the pain is being produced from an inflammatory process. So if we take a very extreme case, for example, something like gout, then steroid injections are going to give a huge amount of relief on the vast majority of cases, because the vast majority of that pain is inflammatory in nature. If we take at the other end of the spectrum, the pain is very mechanical in basis. So in other words, the pain is being driven by a mechanical overload of a joint or a tendon or a soft tissue structure. Unfortunately, the amount of pain relief that we'll get from a steroid in these cases is going to be much more marginal. So you may only get 10, 20, 30%. Again, this can in part be help with the diagnosis and help us to understand more about the condition. And it certainly can explain why sometimes we get less relief than we might have anticipated. So, steroid injections, there are two main steroids that are used for the vast majority of injections, and that is triamcinolone acetate and depomedrone. And we do find from time to time that people get on very much better with one than the other. So they're kind of neck and neck in both in terms of their treatment profile and their side effect profile. And you'll see that generally speaking, they're used in fairly equal numbers around the UK. What I would say is if you have an injection with one of these steroids and the response is underwhelming and you're going to consider a further steroid injection in the future, makes sense to use the other. That's my advice. So this is just a summary really of some of the main factors of why a steroid injection may not work at all or may give a underwhelming amount of relief. The key take homes, I guess, here are around the diagnosis, to make sure that you always see the steroid injection as being part of an overall treatment and management plan, and to be less relied upon as a standalone treatment, and to always have a discussion with the clinician. So if you've got any concerns or we want to understand why the steroid injection hasn't worked, then have a discussion with the clinician. They'll always be very happy to sort of feedback with you about this. If you want to book a steroid injection at Complete Physio, just call our number 0207 482 3875.